Imagine giving birth before hospitals existed. No doctors, no painkillers, no sterile room, no ambulance, no emergency surgery, no machines watching the baby's heartbeat. Just a body, a baby, a few helpers, and a world where almost everything could go wrong. Today, birth can still be dangerous. But in the ancient world, it was even more uncertain. Because giving birth was not just a private family moment. It was one of the biggest survival events in human life. And the strange thing is this. Humans may have needed help during birth for a very long time. Unlike many animals, human birth is complicated. A baby's head is large. The mother's pelvis is shaped by walking on two legs. And the baby often has to rotate through the birth canal. That means birth is not just painful. It is mechanically difficult. For early humans, this mattered a lot. Because there was no hospital waiting. No trained surgical team. No antibiotics if infection came later. No safe C-section if the baby could not come out. So, how did ancient humans give birth? The honest answer is, we do not know every detail. Prehistoric people did not leave birth manuals. They did not write medical books. And childbirth does not always leave clear traces in the ground. But we can still understand the basic picture. We can look at human anatomy. We can look at archaeology. We can look at ancient civilizations. And we can look at the one thing humans have always depended on. The group. A woman giving birth probably did not want to be completely alone. She needed warmth. She needed protection. She needed water. She needed someone to notice danger. She needed someone to help if she became weak. And she needed someone ready to care for the baby once it arrived. That is why birth was probably a social event long before hospitals. Not a modern hospital. Not a clean delivery room. But a small human circle. A mother. Helpers. Fire. Animal hides. Hands. Experience. And fear. In some ancient societies, birth was connected to women who knew what to do. We call them midwives. They were not modern doctors. But they had something very important. Experience. They had seen births before. They knew when to comfort, when to wait, when to help the mother change position, when to bring water, when to keep others away, and when to be afraid. In ancient Egypt, we find signs that birth could involve special supports, rituals, and objects. One famous example is the birth brick. A woman could squat or sit with support while giving birth. The brick was practical, but also symbolic. It connected birth with protection, danger, and hope. Because before modern medicine, people did not separate body and belief the way we often do today. If birth was dangerous, people used everything they had. Hands, plants, water, fire, rituals, songs, prayers, and memory. But the hardest part is this. Not every problem could be solved. If labor lasted too long, the mother could become exhausted. If the baby was in a bad position, there might be very little anyone could do. If bleeding became heavy, there were no modern medicines to stop it quickly. If infection came after birth, there were no antibiotics. And if the baby was too weak, survival was uncertain. This is why birth shaped human life so deeply. A successful birth was not just a baby arriving. It was the survival of two lives, the mother and the child. And sometimes, the survival of the group's future. A newborn human baby is helpless. It cannot walk. It cannot feed itself. It cannot stay warm alone. It cannot escape danger. So the moment after birth was just as important as the birth itself. The baby had to be kept warm. The mother had to recover. The group had to protect them. Someone had to help with food. Someone had to keep the fire alive. Someone had to watch the night. In that sense, human birth was never just biological. It was social. A baby survived because people stayed close. A mother survived because people helped. And knowledge survived because older women, relatives, and experienced helpers remembered what had worked before. This is one of the most powerful things about humans. We are born helpless, but we are born into hands. Hands that hold. Hands that clean. Hands that warm. Hands that protect. Before hospitals, birth was dangerous. But it was not meaningless chaos. It was care without modern medicine. It was knowledge without textbooks. It was fear mixed with hope. And it was one of the clearest examples of why humans needed each other. So when we ask how ancient humans gave birth, the answer is not only in caves or on animal hides. The deeper answer is this. They gave birth with help, with risk, with pain, with tradition, with the group watching over the most fragile moment of life. Because before hospitals, before doctors, before machines, before modern medicine, the first delivery room was not a room at all. It was a circle of people trying to keep a mother and a baby alive.